Have you ever heard that birth control causes weight gain, mood swings, and infertility? Well, we're going to talk about that today. Let's break down the biggest myths in birth control and what you really need to know. If you're new here, my name is Dr. Tosin Odunsi. I'm a board certified OBGYN, and I want to help you understand your body and explore women's health. So hit that subscribe button if that's something you're interested in. Let's dive into the first fact or fiction, which is birth control causes weight gain. This is a tricky one because the weight gain question depends on which birth control method you're using. When we're talking about hormonal birth control, we have to break it down. The one that I see the most weight gain is going to be with the depot injection. And you may see approximately a 5-pound weight gain over the course of the year. And I want to make sure that I emphasize that with the other forms of hormonal birth control, you may see up to 5-pound weight gain in a year. However, I want you to investigate other reasons for the weight gain if it's beyond that 5 pounds. But the one that may cause the most weight gain is that injection. When we're talking about the long-acting reversible contraceptives, meaning the implant that goes under the arm, and also the IUD, we don't typically see weight gain with those. Also, with the hormonal contraceptives, such as the ring that you place in the vagina every month, you don't typically see weight gain with that. The birth control pill, there may be fluctuations in weight, but like I said before, we're not typically seeing more than a 5-pound weight gain in a year. I encourage my patients to investigate other reasons for weight gain. So I have a lot of PCOS patients that have difficulty with weight fluctuations, especially weight gain. I also would want to check your thyroid level because in patients with low thyroid, they can also have weight gain. So I want to make it clear that the depot injection is the one that we typically see more weight gain with, but the others not so much. Let's dive into fact versus fiction number 2, and that's that birth control causes infertility. This is fiction. With all of the hormonal contraceptives, there is not infertility associated with these. I want to point out that the permanent contraception, where we're doing surgery, we are cutting the fallopian tubes, those are permanent. And while they are 99.99% effective, occasionally I have seen patients get pregnant even with the surgery, but the hormonal contraceptives, you do not have infertility caused by those. Fact versus fiction number 3 is that birth control can cause mood swings and depression. This is probably the most common side effect that I see of introducing hormones into a patient's regimen, because those can actually cause mood swings. And with patients who have a history of depression, I'm careful to monitor those patients and monitor their mood. So I evaluate the patients 3 months later to make sure that they're doing okay with their mood and not experiencing new symptoms, because we want to make sure their quality of life is still good. If you do have a history of depression or you experience mood swings when you start a form of birth control, I want you to contact your OBGYN and let them know so that they can adjust your contraceptive option. We want to make sure that you're having the best experience with these, and we don't want you to have a relapse in depression or changes in your mood. And the final fact or fiction is that birth control increases the risk of blood clots. That's false. In my patients, when they're coming for contraceptive counseling, I ask them about their smoking history. And also, I note how old they are. If they're over the age of 35 and are a current smoker, I do not recommend birth control pills because of the estrogen component. Now, in those patients, I'm going to advise not using estrogen and sticking to progesterone-only birth control, because it's that estrogen that increases the risk of blood clots, specifically in those patients that are over 35 and smoking. So the increase in estrogen increases the risk of blood clots because it increases those clotting factors. So you can develop those clots in those vessels down in the leg, and then that can travel up to the lungs, which is very scary and dangerous, and we want to avoid that. But overall, this is not typically a risk that we see with birth control. So there you have it. There are some side effects to birth control, but many of the myths that we see are just not true. So I wanted to reassure you that if contraception and birth control is something that you want to try, go see your OBGYN and have that discussion to see which one is best for you.